Good morning.
Morning, Laura.
Morning, Catherine. Hello,
How are
everybody.
you?
I'm good, thank you. Just waiting for a few people to jump in, but thank you so much to everyone already joined us this morning. We are very excited to have Catherine Anderson here with us today, and run you guys through a bit of a taster about our clinical certification, which is really, really exciting. So what's covered, Catherine's going to tell you all about the amazing work that she does as well. And just make sure to stay on until the end, as we do have a bit of a special offer for everyone that has attended today. Also, just a bit of housekeeping. Feel free to write in the chat if you have any questions throughout the session today. And we are more than happy to answer those for you as well. But just to sort of, I guess, kick off this morning, thank you so much to everyone who's joined us. We are from Unite Health, and we run the APPI Clinical Pilates Matwork and Equipment Certification. So this course that we're giving you a bit of a taster today is your full clinical Pilates training. So we are going to run you through mat work, reformer, Cadillac, split pedal chair, and the arc barrel. So it's very comprehensive. We cover so much in this course to help you really level up your skills in your practice. So to give you guys a bit of background about APPI in itself, we're an education provider that has been around for over 20 years now. So they're very well known worldwide, and our certifications are also internationally recognized. So you can take your training with you anywhere you go. And the training itself has all been designed and delivered by a physiotherapist for allied health professionals. So if you're a physio, an osteo, an occupational therapist, a chiro, the list goes on and on. This course is going to be perfect for you. And the best part about the training is really that after each level you attend with us, you can immediately implement this into your practice. So it's skills and tools that you can use right away to really assist and better, your delivery in working with patients. So it's a really, really exciting training course. Today we have with us Catherine Anderson. She is not only just a physiotherapist, but one of the master trainers here at APPI. So you're in the best of hands today. Ask as many questions as you can, because Catherine is the one that you'll want to go to for that. So I'll pass it over to you, Catherine, just to introduce yourself a little bit, and we can kick off today's session.
Fantastic. Thank you so much, Laura. And thank you for joining us on this Friday morning. Just before we begin kind of my part of it, though, I want to know for you guys about what's brought you to this session today. And so if you feel comfortable, I'd really love to invite you to jump on the chat or give us a bit of a sense of, the kind of things that you're looking for when it comes to the information that I present to you today. Is it something about a particular clinical kind of nuance that you're interested in? Is it, a want to kind of understand the way the research kind of connects with the practice? So if you feel like you have a question, or kind of not even a question, but more like if you feel like you'd like to share with us the reason why you've jumped on this morning's webinar, I'd really encourage you to unmute yourself, pop your camera on only if you feel like you want to, and share that with me and with the group.
Think as a webinar, the participants can see us, but they can't turn their cameras on, but everyone can.
Sure.
Yeah, but we can definitely still receive all of those comments in the chat for sure.
In the chat. Beautiful. So Laura, maybe I'll rely on you if you could, just to read out anything that comes through. So apologies for the format format error there. what I might do then is, as you're kind of formulating that and writing it down, I wanted to talk to you a little bit about the benefits of clinical Pilates. Now, clearly you have a little bit of a sense of what clinical Pilates is, because you're here today. You're interested in learning more, and I'd really kind of love to share with you, I suppose, my understanding of clinical Pilates, but also my journey through my career as well, and how APPI has been a really integral part of that. Now, the thing about clinical Pilates, and we have a lot of clients asking us, what is the difference between clinical Pilates and non-clinical Pilates? The kind of the real nuance of it really is that when Joseph Pilates wrote his original method, he had a very specific kind of order and a specific kind of list of exercises that he would go through, and every person would do every single one of those exercises as part of the class. With clinical Pilates, what we've done with APPI is we've taken those original Pilates exercises that Joseph Pilates has written, and we've turned them into different levels and different forms that you can then pick and choose, as you do with your normal clinical reasoning. You can pick and choose to create rehab programs and exercise classes for your clients. The kind of benefit of doing it that way is that everything you do in clinical Pilates is clinically reasoned. And that, I think, is a big part of the APPI, in that when we teach you an exercise, we don't just teach you the movement patterns, but we tell you exactly why you would use it, what conditions you would use it for. If someone has a movement dysfunction that maybe prevents them from being able to do an exercise, we'll help you to understand why and give you ways that you can modify the exercise or clinically reason to another exercise. And so it really ends up becoming not just a delivery of exercise, but really a treatment. And that's the way that I use it every day in my clinical practice, where if I have someone with low back pain and I'm trying to understand how they're functionally moving, as well as looking at their lumbar range of movement, I will also have a look at something like a shoulder bridge level 1, and then I will use that information that they give me to tell me how it feels to move. I'll understand what the restrictions are in that movement, and then that will help me to formulate my plan. So rather than it being kind of manual therapy and physio first and then clinical Pilates second, it's really kind of integrated from day one. Now, thank you, Libby, who's just shared with us. You're interested in Pilates as a remedial and retraining modality, and you think clinical gives a much broader scope to help with clients. I want to help people live their best life. I absolutely love that, because that's a really cool thing about this particular method of Pilates. It's not just about lying on the mat and doing a class that might make you feel wonderful at the time. It's kind of helping people to push, or to understand how to kind of push and to challenge their bodies, and to discover things that they didn't know that their bodies could do. And I mean, I'm really, we get into it a lot more on the Mat Work one, but I'm really kind of passionate about that idea of where the concept of Pilates then kind of merges with performance. And so, that really kind of helps people to move forward. So thank you, Libby, for sharing that with us. And again, feel free to, to keep writing if anyone else would like to share their motivation for joining us today. Now, the other lovely thing about the APPI courses is that it doesn't really matter whether you're a new grad or experienced clinician, or even shifting roles. So I'll tell you a little bit more about my journey, but I'd been teaching Pilates for a few years before I did the APPI course, and I thought I knew a lot about Pilates, and I just really loved the way that the APPI kind of gave me lots more tools to really understand the reasons why. And if anyone has any really specific kind of questions or kind of situations that you're in that you'd like to share with us in that sense, please let us know on the chat. The other lovely thing that I really appreciate about APPI Pilates is the way that it teaches you how to do things safe and effectively. And I think as prescribers of exercise, there's always that risk that if we ask someone to push too hard or to go too far, that we will, potentially cause an injury. The way that the mat work particularly is set out, we start or they took Joseph Pilates' original exercise, and then they broke that down into somewhere between 4 and 6 levels. So we start at level 1, level 2, level 3, level 4, level 5, which gives you this really lovely kind of safe layering of being able to understand what are the kind of almost checkpoints you need to do on level 1 before you then proceed to level 2. So it kind of takes the guesswork out of it. Linking into that performance piece on Libby's comment just there as well, is that as a kind of younger, kind of less experienced physio, if I had that question of, can I go running, or am I ready to return to running? I used to just kind of go yes and like keep my fingers crossed. But I feel like the skills that I've learned in APPI about kind of how to layer my treatment means that, you know, I can then say to that person, well, let's do a few tests. Let's look at your movement patterns. Let's see how your body is performing when we ask it to do an activation of your glutes, or a standing on one leg, or a running stride. And then I can give them a really specific answer to that question, rather than just say yes and keeping my fingers crossed and hoping it'll all turn out okay. And so that's this idea of, the without the fear of re-injury. I think, when I see our clients kind of come through here at Viva, they have this kind of real understanding of kind of seeing the platform of what their body can do. The idea of the body awareness. And so I think the really lovely thing about doing APPI Pilates is that you'll learn a lot more about how you move by doing the practical component of the course. It's a beautifully put together course because there's a lovely combination of theory and practice. We look at research, we look at, the kind of the whys and the whats, and then we'll look at the how, and you get heaps of time to experience in your own body. It's very common on a Mat Work 1 course that we'll have people and experienced physios or experienced osteos, or who's been working in the Pilates industry for a long time, but they've had a long history of lower back pain themselves. And then as we use the APPI method to understand the way they're moving, they'll have these light bulb moments of like, oh, I can now see why my facet joints are loading, because I'm using kind of this method to move. So that's a really cool thing that you get to do with your own body as well. So I touched on this a little bit already, but my pathway into clinical Pilates, when I graduated from physiotherapy, that was in 2001, and it was pretty quiet on the Pilates front. I think in the last week of university, they told us there was this thing called transversus abdominis. We were told core stability was important, and there was emerging research to say that core stability was important, but really the practical component of that was relatively non-existent. Moving into 2004, I took on my first private practice role. And in that role, they said, we want you to teach Pilates classes. So I started teaching by Googling what is Pilates and borrowing a DVD off a friend. In that first 6 months of teaching, I also did my DMA training. And by the end of kind of 2005, I was feeling like, oh yeah, I'm okay. Like I know how to do this stuff. Now in 2006, there was an opportunity arose for me to present for APPI, and so through that process, I enrolled in the Mat Work and Equipment Certification. As I said, that kind of process of doing the APPI method kind of really opened my eyes to not just being a prescriber of exercise, but really a kind of clinical analyzer of exercise. In 2009, I opened my own clinic and studio. So it's called Viva Physiotherapy, where I'm coming to you here today. I'll show you there'll be a clinical Pilates class on just now in a moment. So I'll take you through and show you that. And now that I've had the clinic for around kind of 14, 15 years, I now have a policy that all of my staff do APPI mat work as their first kind of initial training. That kind of is so far reaching for me, because not only does it mean kind of continuity of the method and continuity of the client experience, I also do see it as a real kind of safety element, that I can be guaranteed that my staff have been taught that clinical reasoning when it comes to layering exercise. In 2016, I got the opportunity to become the master trainer for APPI, as Laura mentioned, and I've been presenting courses all the way through that time from 2006. So as well as just the work I directly do with APPI, I'd say the method really infuses single thing I do in clinical practice. I have a master's of manual therapy, so I'm a very, very big fan of the kind of the hands-on and the physical kind of element of physiotherapy, but I really kind of merge it. As I said, all of my objective assessments have APPI kind of overlaid on it, so I'm looking at kind of movement patterns at the same time as what I'm looking at just the objective measurements themselves. So I'm going to run through a little bit of practical now. And one thing that really kind of anchors and hinges on APPI Pilates is what we call the 5 key elements. And so this is unique to APPI, but it really helps us to create a platform where we understand the way that people are moving. And it helps us to analyze, when we've got movement patterns that may be contributing to injury or movement patterns that may contribute to recovery. So the first of our 5 key elements is breathing. Now, as well as just the idea that we do need to breathe, and on Mat Work 1, we really kind of talk and analyze about the history of breathing in Pilates and the styles and methods of breathing in for Pilates, whether it's breathing in or out on the effort, that kind of thing. I think one thing that I get really excited about is the mechanics of the breathing. And so thinking about kind of the rib cage and the way it then attaches into the primary sling or into the core, I love how you can kind of influence the way that the muscles are moving by the way that you breathe. So if you're happy to, in the position where you are, I'd love to invite you to close your eyes, take a breath, and just acknowledge or observe the breathing pattern that your body is using today. Now, if you'd like to do this in a little bit of a deeper way, you've also got the opportunity to hop onto your mat. And if you do happen to go onto your mat, you can place one hand down low and one hand up high, so you can observe your breathing patterns. And so there's different types of breathing. And obviously there's different types that are useful at different moments in your life. So say, for example, if you're doing yoga, or if you're singing, or if you're playing a woodwind instrument, using the stomach to expand helps to maximize the lung volumes. But in our Pilates, where we're not doing a particularly kind of high volume lung exercise, what we're really looking for is lateral breathing. So if anyone's done any cardiothoracic work in hospitals, you'll know we talk about bibasal expansion, but just that idea that you can breathe laterally and wide into the back of the lungs, which is where all the big lung volume sits. But you'll also notice that by doing that, it reduces the chance of you using your apical breathing, which is using up here. And the issue with apical breathing is that when someone uses these muscles, the accessory muscles up here to breathe, they're likely to be getting tired up here because these ones are a little bit more fast twitch as opposed to your intercostals being slow twitch. And that often does then lead to, neck pain and fatigue around the shoulders. Now, I can guarantee you on a Mat Work 1 course, if we have, say, 20 people in the room and we do this process, when I ask the group to put up their hands if they do observe apical breathing, those who put up their hands, I'll then ask the next question, which is, do you have neck pain? And the answer will always be yes. And so I love the way that even just through the first key element, it gives us a little insight into, into how that person moves and therefore how it might be contributing to their injury. Okay, so I'm going to move on to the next key element now, which is what we call centering. Now, there's a couple of different parts to centering. Number one, there's the pelvic position. And then number two, there's also the engagement of the core. Now, this is what I think makes the APPI Pilates unique. And we look in detail about how we have the relationship of the rib cage, which is our key element 3, how the relationship of the rib cage is with regards to the position of the pelvis. And what we're looking for in APPI Pilates is what we call a neutral spine, which means we're not flat on the floor like Joseph Pilates used to use in his traditional Pilates. And the reason he used to do that was a lot of his first clients were dancers and ballerinas. And of course, that posterior pelvic tilt is very functional for them. But for the rest of us, we do want to have a nice little lumbar lordosis, but we want that lumbar lordosis to come without excessive flaring through the ribs. So just now, if you do happen to be either lying down or sitting, and invite you to put one hand on the base of your ribs just across here. And I want you to feel whether your ribs are sticking right forward, whether there's a big lump just there, or whether your ribs are kind of soft and sitting flush with your abdominals. And of course, we're looking for the second. And then from there, we then push forward with our tailbone to create that little lumbar lordosis. And that combination of the two is what we call neutral spine. So that then gives us the platform for when we are going to do our mat work exercises. It means that we are moving in a way that holds the core so that the limbs can move independently. It means that we're less likely to load the hip flexors. It means that if we're doing things like abdominal exercises or abdo prep, we're much less likely to load the neck. Now, it's just worth quickly saying, if any of you in the webinar do work in the women's health space, we're really kind of conscious of the role of the pelvic floor in that primary sling. And so we have the rule, I suppose, that your pelvic floor always needs to take priority over what we build on top of that. And so in the course, we talk a lot about the nuance of, scope of practice and when we may refer out into someone seeing a women's health physio, and how you can kind of then safely layer with respect to the work of the pelvic floor as we bring in more load. So I think that's really important. Now, as far as shoulder blade and head and neck placement, in traditional Pilates, Joseph Pilates used to say, press the shoulders down and away from the ears. And that's, again, a very dancing cue, because it means that the neck looks lovely and beautiful and long on stage. But if everyone would like to have a feel of that now, just by pressing their shoulders down, you'll notice that what it actually does do is it creates a drag through the nerves and the tissues, and it creates a little bit of tension in the neck. And so the thing that I think was really eye-opening for me when I learnt the APPI method is the way that we talk about our shoulder blade positioning very dynamically. We give respect to what the scapula is doing as well as the glenohumeral joint, and we don't just kind of give a one-size-fits-all cue for the shoulder blade placement. Now, if you're really interested in the kind of the specifics of shoulder, it's equipment level 2. We'll go through the levels in a moment, but equipment level 2 is completely focused on the upper quadrant, and there's about an hour-long lecture in there that talks about the research behind shoulder biomechanics and how to correct that effectively for clinical issues. Finally, head and neck position. So with the head and neck, what we're looking for is to make sure that the head sits over the body, but also that the angle of the body, the angle of the head is in what we call neutral. So for most of us, it'll mean that we want our ear over the center of our ear, over the center of our shoulder. So that's that horizontal movement. But also with regards to the deep neck flexors, either shortening or lengthening, we pretty much, this works for most people, pretty much want our forehead and our chin in the same plane as each other vertically. So of course, if I have this lovely vertical of ear over shoulder, but I have my chin poke, obviously that's going to lead to some upper cervical issues. But if I can get that nice length, that helps me to engage here and keep the length. So that's just a tiny little taster or touch on the concept of the 5 key elements. But of course, not only do we go into that in a lot more detail on Mat Work 1, it really infuses the entire repertoire. Okay, so I'm going to talk a little bit about mat work exercises. And if you did have any kind of questions or even comments, or if you feel like you'd like to share your experience or understanding of what I've talked about already, you're really welcome to pop something in the chat. And now's just probably a good time for you to do that. Now, with APPI, we have 2 kind of processes of training. We have mat work training and we have equipment training. So what we recommend is that most people do mat work training, or at least the Mat Work 1 first, and that then gives you all of those kind of fundamental skills initially to infuse into your equipment training. And what I've done here is we've chosen an exercise called the leg pull prep in prone, which is from Mat Work 1. And I'm just going to talk about some of the kind of nuances of APPI and why it is that we kind of use this prep exercise, like a low-level exercise, to layer the movement. Now, the original Joseph Pilates exercise is what we call leg pull in prone. And what the leg pull looks like is the person is in a full plank, and then we're moving into this movement here. Now, that looks kind of, like an interesting enough exercise, but what we know as clinicians is there's a lot of reasons why people might struggle with that movement. And when I say struggle, it might be struggle in the realm of it may produce or reproduce or their pain or irritate their injury. But when I say struggle, I also mean it might mean that they're just not very effective at it. Maybe they, they can't get a really good leg lift, or they can't get really good glute max when they do lift up. So we've broken it down into levels, and the leg pull in prone prep is what we would call the level 1. So if I talk a little bit about the nuance of the level 1, what we really get out of level 1 is the way that the hands attach to the floor, and then the framework that we have here through the deep neck flexors. So in mat work 1, we have an exercise called swan dive, which is, I suppose, like the entry level exercise for the deep neck flexors against gravity. But here we're bringing in a combination of the deep neck flexors as well as our scapular stabilizers, and also the core stability when it comes to the knee lift of the actual exercise of leg pull prep in prone. So if you do happen to have a mat, you can jump down and have a little go of this now. If you don't, you're very welcome to watch me do it. But the way we would instruct it is to press your hands strongly down into the floor, and then press your head away from the floor with your eye gaze looking at your thumbs. Tuck your toes underneath you, breathe in, and as you breathe out, set your center. Breathe in again, and as you breathe out, I'd like you to hover your knees up off the floor. Now, I'm going to use this as an assessment, and I'm going to show you how I use this in every day. So what I'll do is I'll ask my clients to hold this for up to 30 seconds. Of course, if they're feeling their pain, they'll stop earlier. But as they hold for the 30 seconds, I'll say to them, where are you feeling the load? If you're really good and strong in your core stability, your body should feel light against the floor. But if there's issues in areas where your body is losing its biomechanical chain, you'll notice that the load goes into particular places. So first of all, the classic one is people say, I can't do this because of my wrists. And when we're in this position here, some people just think their wrists are weak, but really what I've seen over time is the people who do struggle on their wrists are those who don't have a great upper quarter chain. And what I mean by that is if your scapular protractors are not working and you're hanging down with your chest, if your deep neck flexors are not working and you're hanging down with your head, what will happen when you go to do the exercise is that the effective pull of gravity will go down through your wrists and make your wrists feel uncomfortable. So what works for, in the end, everyone, it's slower for some people and it's faster for others, is to really kind of cue that pressing away and to say all of this has to take the load of the body and all of these have to take the load of the body, so that then when you do the movement, you've got this really beautiful stable base. Now, we go into it a lot more on the course, but the nuance of kind of what's happening in the wrists. For some people, if they've had this issue for a long time, their wrist joints end up so sore that they just can't get the 90 degrees extension. And so for that, we'll usually start them back here, teach them the beautiful scapular stability and start to kind of bring them more back up over their wrists and kind of work on that process in time. Sometimes we put people on their knuckles to take the load out of their wrists so they can get strong in their chest and shoulders and deep neck flexors. But effectively, we can modify it until they are strong enough to get their hands on the floor. And you think about Libby's comment before about, really being able to show people how to kind of, to use their body at the best. People who have this issue, they'll avoid things like yoga, they'll avoid things like, circuit training, because they can't do the planks and the, maybe the burpees in circuit training or the high planks and chaturangas in yoga that will then allow them to enter that type of exercise. So you can see here how using the APPI as a framework means that we can then progressively build them up, which then opens a lot more possibilities in the future. Now, looking at the other end now, what we tend to find is that when the knees hover, we're really reliant on what's happening in the core. And of course, this should be, an anti-gravity core exercise. Now, what happens for a lot of people is that they tend to feel the lift through their quads. So if that was you, when you did the exercise, I'd love to invite you to check back in on your neutral spine. So as we lift up, if our tailbone is in posterior pelvic tilt, we will find that the quads will start to become overactive. But if we can keep our ribs high and kick into our tailbone and get our tailbone right up to the sky, you'll notice that takes the work out of here and into here. And now the old question of like, can I do this? And I used to keep my fingers crossed and hope people would be okay. When my patients ask, can I do a circuit training class? Can I go and do a mat Pilates class? Can I do, something where there's less supervision? I'll say to them, when you do that movement, what percentage are you using your core? What percentage are you using your legs? What percentage are you using your back? And I'll effectively work with them until they can get 90 to 100% in their core. And that's where we know they're going to be loading safely. Okay, so the idea of that then is it brings us into our mat work 3 exercise, which is the full leg pull in prone. So I'd like you all now to have a go at the leg pull prep in prone, trying to press away, lifting your head, tailbone up to the sky, and reassess in your body and see how that feels. Now, if you do find you've still got a lot of legs overworking, if you do find that your neck is feeling tight, if you've got a lot of pressure through your wrist, we say right now, you maybe don't progress to mat work 3. But if you're feeling like you're nice and strong in your arms and your hands, if you're feeling like your body's feeling light against the ground, you can move into leg pull in prone level 3, which looks like this. Move to the back of your mat. Breathe in, and as you breathe out, bring your hands forward, tuck your toes underneath you, and push yourself forward into plank. Press hard away from the ground, looking down at your thumbs. Inhale. As you exhale, a nice straight long leg will reach right back and up behind you, and then we'll come back down to the floor. Exhale to lift your other leg, come back down to the floor. Now we're folding back into our 4 points, so press with your hands, see that all that beautiful overhead strength you're getting there, and then you'll release your knees. So that's a little kind of taster of what our mat work 3 leg pull in prone looks like. And you can see there how the exercises will layer. So the way that our mat work certification goes is we have 3 levels. A mat work level 1 is like the foundation. So that really gives you kind of the platform and the theory of everything you'll do after that. In our mat work 2, we look at focusing on warm up and cool down repertoire and group class teaching. And then in the mat work 3, just like the leg pull in prone you've just done there, we look at more advanced repertoire and higher amounts of loading. So you can see it's a really nice progression as we go through. Now I'm going to space, and if my knee falls down there, if I don't have the external rotation strength against gravity, we'll find that that might impinge my hip, or it might end up creating some low back pain. From a top view, this exercise also has a really close connection to the neutral spine. And so what it's really common to do is as someone comes into flexion, we find that the person falls into posterior tilt, which ends up meaning that they feel this in their quads rather than their glutes. So keeping that tailbone out that we talked about before means that then when you go to push, you've got the platform for glutes to work, and those glutes will work entirely through range. So on the course, we teach lots of different variations. Sometimes we use plie, and that's helpful for that person who doesn't have anti-gravity glute med rotational strength. We also do jump board work as well, just to start bringing in more loading. And we'll talk about kind of the clinical conditions that will kind of lead us to choosing those types of movements. Cool. So she came to me, she was a 38-year-old professor of law at Melbourne University, and 5 years before that she'd had a fall from a horse and a fracture at T8 to 10, no neurological compromise, but she'd had a fairly decent whack of chronic pain as a result. Now, her words, she said she was on the pathway to total and permanent disability. So you can imagine from a from the perspective of almost society, she's the real
in person, so that you can come in, use the equipment that we have in our studios to really make the most of the training days with us. So we've got the 3 levels of our mat work and the 4 levels of the equipment. As Catherine mentioned, it's really great to start from mat work 1 and all the way through to equipment level 4. But at the end of the day, you do have that freedom to be a bit flexible with it. So after you do the mat work level 1, which is the first course of attendance, and then you can move through the other levels in any order that you like. So if there are some dates there that aren't suitable, you do also have the option to select TBC, so you can book that on the next intake that comes out, basically. So it's really quite flexible. You can work it around your schedule and sort of just have up to 2 years to kind of work through those course levels there. And in this course, I know we did a couple of exercises today, but you will learn over 250 clinical Pilates movements. So it's going to give you a really wide wealth of knowledge to be using day to day to really assist your clients in a better space. Let's get to the special offer now. So that's just on the next slide for me, Catherine, if you don't mind flicking that one. Thank you so much. So Normally this course is sort of around that 6,300 mark. It is currently reduced on the website down to 4,995. So there's already a pretty decent savings available on this training course. But just for joining us today, we are extending out an additional $350 off the course. So only 4,645. You get your 14 days of training there, all of your hard copy manuals and your certification assessments all included. There are payment plans available, but generally for the additional discount, you will save the most if you do pay up front. So feel free to note down that voucher code there, CTNOV23. That's going to apply at checkout, that discount there. Now, also, if you're still sort of wanting to maybe have a bit more of a chat about the course itself or how it could work for you, feel free to book a time to chat with myself or one of my colleagues through our website. And we can sort of sit down and run through what the best option is going to be for you to get started. So happy to chat to anyone that has any questions. And if you'd like to pop any questions in the chat this morning as well, Catherine and I can stay on for a couple of minutes to sort of just run through any questions that you guys might have about the course itself. So we really, really want to thank everyone for their time today, and hopefully you'll take advantage of that amazing discount there and get started this year. So we do have a MatWork Level 1 actually starting on the 4th and 5th of November. I believe there's some final spots left. And if you are interested in even getting some equipment levels done this year, I know in Melbourne and some interstate we do still have a couple of spots left in the final intakes for this year. But another thing we'll mention today is we are launching the 2024 dates. So the first kind of few months of dates will be available from today onwards. So keep an eye out on your emails, and that will all come through for you really, really shortly.
And I'll just jump in there. I'm taking the equipment level 1 on the 18th and 19th of November.
Amazing. Thank you so much, Catherine. So if you want to learn more from Catherine, she will be in Melbourne teaching that equipment session coming up in November. So feel free to book a time to chat with us, or just jump on and book your spot into the course so you can come along and experience what APPI is all about. Someone's just asked if we can rewatch this later. It is recorded, so we will do our best to kind of get this out for you to have a watch of if you wanted to have a look back and see any further details about what was covered today. So thank you so much for joining us on a Friday morning. Hopefully this time really works with your schedules, but let us know if you have any questions. And thank you so much, Catherine, for joining us today as well. We really appreciate you and all your hard work that you do for Unite Health. So yeah, I hope everybody has a really great weekend. And as I mentioned, we'll stay on for a few minutes and see if anybody has any questions. We're more than happy to help there.
Thank you.
Hi, Matten. Yes, so the entire course itself is 14 days of training. So each level, you may remember we said MatWork Level 1, 2, and 3, and Equipment 1, 2, 3, 4. So each level is 2 days of training. So a Saturday and a Sunday from 9 to 5 on both days would be your MatWork Level 1. And so forth for the other levels. So 14 days in total, but you have 2 years to work through those individual levels. And after level 1 of the mat, you can do them in any order that you like. So it's really on your terms as to how you get those 14 days completed.
There's a question that's come from Libby. Is this course appropriate for non-physios or allied health professionals? And can you do the clinical on its own, as you will soon do your MatWork and Reformer certification? So that's a great question, Libby. And the kind of the intake for this particular stream of clinical Pilates is just that you have like a solid foundation in Pilates. So where would you have allied health professionals coming on the course? We also have very experienced non-clinical Pilates instructors coming in as well. So it sounds like you'll be well placed there. Now, the question of can you do clinical on its own is the entire certification of both MatWork and equipment are, clinical Pilates. But it sounds like if you've already done a really nice amount of MatWork and Reformer in your own certification, I would just really encourage you to at least just do MatWork 1, because MatWork 1 is where we talk about the kind of research behind it, the fundamentals and all of that kind of thing, so that you may then be able to take that away and kind of apply that and lay that over on your current certification exercises. And then once you've done mat work 1, it will give you a bit of a taster to say, do you want to go further? Or, you know, is the kind of just that kind of foundational course enough to get you started?
Yeah, and same goes for anyone that may not have an allied health background, but may have potentially done their mat work and reformer certification. If you have already completed your formal training as a Pilates instructor, you can come through the APPI Clinical Pilates Equipment Certification just to upskill your knowledge, as Catherine said, sort of layer onto what you've already learned, but really advancing your skills on the reformer, learning the Cadillac, the split pedal chair, and the arc barrel, and just opening up more opportunities for yourself as an instructor in the industry. So that's a nice pathway for those people that may not have an allied health background and are looking to sort of add in a bit of a clinical piece to their skill set as well.
Great. And we've got another question here. So someone has asked, can you please give more information about the practical hours after and during the course? I live in a regional area and we don't have many studios to complete the practical hours and get the hours signed off. So effectively with mat work, that shouldn't affect you at all, because, you know, if you can get a mat and roll it out, then you'll be okay there. Now with the equipment, there's an element of being comfortable with how to change the springs and that kind of thing on the equipment. But just through the courses themselves, you do get 8 days to play around. We're always really happy if you want to kind of, you know, stay and use the equipment over your breaks or, you know, lunch times and that kind of thing, just to get some extra time. And then you really might then do a lot of your kind of learning of the equipment stuff while you're on the course. Go home and kind of and learn your theoretical stuff and even apply it to mat work movements when you're home. And then it really then just comes down to, if you feel like you want to do the equipment exam, mat work and equipment exams are separate. So mat work exam shouldn't be a problem. If you did want to do the equipment exam, it might just take, I'm thinking about my staff, maybe 2 lots of an hour to get access to a studio, just so you can go back and just be really familiar with the springs and the loadings and just the way that the machines work. So there is requirements that you do your own self-practice, but it doesn't necessarily have to be on the equipment. So self-practice can look like anything from reading through your notes, making mat work variations of the exercises, you know, thinking about the kind of the load and progressions and regressions and that kind of thing. So it can certainly be adapted.
Amazing. Great.
Lovely.
Perfect. Well, let us know if there's any other questions to come through, guys. Really appreciate you being so engaging with us this morning. And hopefully everybody's going to have a wonderful Friday and a beautiful weekend. Let's hope the weather holds up in Melbourne and we get some more sunshine.
Awesome.
Thanks
See
so
you
much.
later.
Thanks, everybody.
Are you happy for me to stop recording now, Laura?
Yes.